Good afternoon, and thank you, Governor and Director, for the updates. I'm going to provide a quick overview of where things stand operationally with regards to our vaccine campaign. As most people probably know, we opened eligibility last week to people 60 to 64 and people 16 and 64 with specific underlying health conditions. This was great news because this meant that we'd vaccinated in excess of 80% of Rhode Islanders that are 65 plus. It also meant we had a strong start and we'll be able to continue to vaccinate at a high rate in the state. However, we're very aware that since we've opened up eligibility, this was 150,000 Rhode Islanders that were newly eligible, and the demand far outpaced supply. This wasn't something unexpected, and we appreciate everyone's patience. But any day that we opened eligibility to these groups, especially at this stage in the vaccination campaign, we would have far outpaced the supply that we've received from the federal government. So with that, we're continuing to improve our scheduling experience with more information to follow in the coming weeks. But the good news is that, as Dr. Alexander Scott said, supply increases are on the way. Another piece of good news is that more first dose appointments will become available because of the natural rhythm of our statewide vaccination effort. There are weeks when a large portion of our vaccine needs to go towards people's second doses, because 3 or 4 weeks prior we'd had a large surge in first doses for vaccinations. This is the case now, in the middle of February, as Rhode Island shifted to phase 2 of the vaccine effort and significantly increased the rate of vaccinations. First doses soared, but that means that at the end of last week and through this week, we have less of our vaccine available to start new people with their first doses. We're posting new slots regularly on vaccinateri.org on Tuesdays and Fridays, but we're happy to announce that we have an additional 1,500 slots that are going to be made available today in addition. This reflects how responsive our vaccine effort has been able to be as we rapidly manage and dynamically reallocate doses as they become available throughout the state. We saw a great response from our teachers, school staff, and child care workers, and a tremendous partnership from our retail pharmacies and municipal clinics dedicated to the effort. A large number of our school staff, teachers, and child care workers were able to be vaccinated through our retail pharmacies, which freed up some additional doses from our dedicated municipal clinics that we could then redistribute to other eligible groups. Tomorrow at our normal 5 p.m. time, we'll release another 3,250 new first dose appointments. I want to take a moment now to give people a sense of how much vaccine is coming into Rhode Island and how much is getting administered. 55,082 doses were administered in Rhode Island last week. That number is for both first and second doses. The amount of vaccine we're receiving in Rhode Island is still around 47,000 doses per week. This week we received 47,600 doses of vaccine. That vaccine usually comes in on Mondays and Tuesdays each week, as you see our administration rates fluctuate. We expect to administer 62,700 doses of vaccine this week. You'll notice that we're administering more vaccine this week than we are receiving. That's because most of the vaccine that we administer this week arrived in Rhode Island last week. In that same way, most of the vaccine that arrives in Rhode Island this week will be administered next week. Looking forward, we anticipate receiving 50,980 doses of vaccine next week. We're expecting steady increases in our allotments of Pfizer and Moderna vaccine, and are expecting large increases from Johnson & Johnson. All very good news. Currently, Johnson & Johnson is producing roughly 500,000 doses a week right now for the entire country. That is expected to increase to between 5 and 8 million doses a week. What that means for Rhode Island is about 16,000 doses a week of Johnson & Johnson vaccine will be available by the end of the month, compared to the roughly 1,500 we are getting now, and that 16,000 figure is slated to continue increasing. Because we expect so much more vaccine, we've continued to work hard to build out our capacity. Currently, today, we have the ability to administer 100,000 doses of COVID-19 vaccine a week. We're planning and anticipate to be able to push that number up to 160,000 doses per week by the end of the month, pending allocations. Because of the supply increases coming to Rhode Island and because of the infrastructure expansions we've made, we have high confidence in that April 19th date that Dr. Alexander Scott shared. On the infrastructure side, we have 2 more large state-run vaccination sites planned, one in Woonsocket and one in South County, and both of those locations will be prepared to open by the end of the month, again, just waiting on additional allocations of vaccine. We're also planning to integrate 3 additional vaccination sites supported by cities and towns open to all Rhode Islanders, just like our larger mass vaccination sites. We envision these opening in the southwestern part of the state in Westerly, in the northeastern part of the state in East Providence, and at a 3rd site in northwestern Rhode Island that the team is continuing to plan the location for. You'll be able to register for these sites in the same way that people register for the other mass vaccination sites through vaccinateri.org. These sites will be open when we have enough vaccine coming into Rhode Island, hopefully in the coming weeks. As all this planning is happening, new vaccinators are also coming on board. Stop and Shop and Walmart both have pharmacies, and both will be vaccinating at select locations in Rhode Island, just as CVS and Walgreens. When eligible, you'll be able to go on the websites for Stop and Shop and Walmart to make appointments. The last thing I want to update on today is vaccinating for homebound Rhode Islanders. Some health agencies and other vaccinators have started to vaccinate their homebound clients and residents. However, as Dr. Alexander Scott has outlined, we set up a partnership with 3 agencies to administer COVID-19 vaccine to homebound people in their residences. Those agencies are Alert Ambulance, MedTech Ambulance, and PACE. We worked hard to collect information about people who cannot get out of their homes to get vaccinated. We developed an online form. We'll continue to engage with our communities and our stakeholders here and partner with the Office of Healthy Aging, health insurers, senior centers, healthcare providers, and others to collect this information. The people we have information for currently will be contacted to schedule appointments, and these 3 agencies will start administering shots as early as tomorrow, though many people may not have appointments scheduled for a few more days. So this is great news, as Dr. Alexander Scott said. Access and equity are 2 key pillars for this vaccination effort, and we're very excited to be reaching these critical populations.